Hi, my name is Jennifer Say, and today I will be talking about neurofibromatosis type 1. Neuro, Neurofibrosis type 1 was first described in 1882 by von Wackelhues. Many discoveries have been found out about the disease since 1785, when a man named Mark Agassiz came up with reports on symptoms his patients were having, such as skin knots, skin patches on his legs, and bed sores. What is neurofibrosis type 1? Neurofibrosis type 1 NF1 is a genetic disorder that causes non-cancerous tumors to grow along the nerve. NF1 is hereditary and it's an autosomal dominant, meaning only one parent needs to have the mutated gene in order for it to be passed down. In this photo, you can see the possible outcomes of a child being diagnosed with NF1. On the left side, we have the father having the NF1 gene in their gene while the mother doesn't. And you see that at least 50% of their children, there's a 50% chance that their children will have NF1. Causes of NF1. NF1 is caused when a mutation occurs in the gene and creates neurofibromin. Neurofibromin is a protein whose main job is to prevent cells from growing and dividing too fast. For neurofibromin to do its job, it turns off the proteins called RAD, whose job is to stimulate cell growth and division. Symptoms of NF1. Neurofibromatosis type 1 causes symptoms such as groups of freckles in places such as in between the armpits, between your stomach and thighs. Other symptoms of neurofibrosis type 1 are light brown spots called Ka-Ala-Fi spots, appear mostly in babies, but over time grows and spreads into adulthood. Problems with the bones, eyes, and nervous system. Non-cancerous tumors under the skin. 2 or more lymph nodes. Learning disabilities are more common in males. Most of the symptoms of NF1 begin in the early days of childhood and go on to adult years. In this photo, in the photo on the left, you can see the non-cancerous tumors going alongside someone's back. They can grow to this size or even larger. On the photo to the right, you see almost all the symptoms listed. You see the tumors, you see the calaf spots, and the freckles under the armpits. We could also see that in this photo that how it can affect your eyes, how the lumps might look under your skin, the calf spots. Who are diagnosed with NF1? Neurofibromatosis type 1 is a genetic disease, which means only one parent has to have the disorder in their gene in order to pass it down to an offspring. If both parents carry NF1, there's a 50% chance that all offsprings have neurofibromatosis type 1. Doctors diagnose people based on 2 tests, which are clinical diagnosis and genetic testing. Clinical diagnosis is when they check your body for symptoms such as signs of 6 or more Kapha-Ala spots that are at least 0.5 centimeters in size on a child and 1.5 centimeters on adults. Genetic testing is done by taking blood samples, which are then analyzed to see if the person has a normal or changed copy of the gene. A flaw with genetic testing that is not always helpful for giving clear results. Possible results are positive, negative, and inclusive. Treatments for NF1. Neurofibromatosis can affect all neutral crest cells, including Schwann cells, melanocytes, and endoneural fibroblasts. It may affect the bones, causing severe pain. Treatment for neurofibrosis type 1 can be surgery, radiation therapy, chemo, or both. May be used to treat some tumors associated with NF1. Medication acupuncture, behavioral interventions for pain and ADHD, bracing, observation, surgery for bony lesions. Here you can see more photos of people with NF1 and how it may look on certain body parts. And it also shows that 120 people are born with NF1 each day. And here are my works cited page. Thank you very much for listening.